Hello, friends. Your friend McKenna here today talking about hallucinations with dementia. This is just to discuss things that you can be aware of as you care for your loved one with dementia. So, when people have dementia, their brain is damaged, and um, because of the damage on the part that interpret information, they can misinterpret their environment. And basically, hallucinations is seeing things that aren't there or hearing voices that are not there. Some people might talk of feeling like there's bugs crawling on their skin when they have hallucinations. So if your loved one is saying that they are seeing people that are not there, don't laugh at them. Don't make fun of them. Reassuring them and remaining calm. Ask them what they are seeing. If they say, for example, they are seeing people, assess the situation, assess the area, especially at night. If your room is lit, there might be shadows. And when someone with dementia sees the shadows, they might see it as somebody moving, and so they can be afraid because of that. So assessing, seeing what they might be pointing at, and you can remove if it's items that are in the way, you can remove them, or if they are shadows, you can reassure them and show them that there is really no one there. Also remember they forget easily. So if they wake up 2 3 times, one key thing is always remind yourself that they are not doing this to punish you or to hurt you. They can't help it. So when they forget and have repeated behaviors due to hallucinations, remember they are not doing anything to punish you. So showing signs of anger towards them causes them to be more confused, and they themselves can become aggressive because they are right. In their mind, they are seeing what they are seeing. So if you go and you are upset at them, it upsets them because you put them in a place of desperation. So always remember, as a caregiver, you are the responsible person. You are the one to go down to where they are and help them out. Making changes to the rooms, to the areas where your loved one is a good contributor to hallucinations happen. Changing how the room is set up, maybe moving furniture around. When your loved one is used to a certain way that the room looks, and then you move it around, be aware that that can cause them to think they are seeing something that they are not seeing. I care for my father, he has dementia, and I have had nights where, especially if we have handed a set of furniture or moved things around, I know that that night he's going to have hallucinations. He's going to wake up and see a shadow at the opposite place, and he's going to think there's somebody. So, reassuring them, reassure them that there is nobody in the house. My dad will ask questions like, "Are you sure all the doors are locked? I saw people, I saw them, they are here." And go with them and check and say, "No, there is no one." Are the doors locked? Yes. Is everybody else okay? Yes, everybody else is okay. So remaining very calm, reassuring them, making sure the objects are not in the way. Also, watch out for their safety. Are there cords on the floors? Because some of the times when they are having hallucinations, it might scare them and they might walk first, faster than they normally would, trying to move away. When my father was living in his home and he was younger, and as the protector, he would always make sure he had like a big walking stick and a very big knife. They call it panga. Here I hear my husband calling it machete, like a very big knife that he would keep like a weapon, just in case something went wrong. So sometimes my dad will ask me, "Where is the machete? Do you know where it is?" I'm like, "We don't have that, and we don't keep that in the house." Where is this? He's looking for where is the spotlight. He want a spotlight. So my dad, even when there's electricity late in the house, at the middle of the night, you'll see him walking around with his spotlight, looking, touching with it, lighting with it, because that's what he is familiar with. So even giving them those things that bring them comfort, like my dad, he doesn't need to have a spotlight or a torch or a flashlight, whatever you call it. He doesn't need to have it. We keep his space very well lit at night. I mean, not late like his bedroom. We turn it off, but there's night light, there's dim lights, but it's always well lit so that he can see his ways around. So he doesn't need a flashlight, but he always has it because it's comforting to him. So, as much of their life as you understand also helps create space for them to avoid more hallucinations. There is medication for hallucination when it becomes a problem. However, you also have to look at the side effects of the medication and weigh in. I always look the risk factors versus the benefits. So, for my dad, he is not on any medications for hallucinations because it's not worth the side effects. He is doing really well. So, just assessing where your loved one is and figuring out what helps. A lot of redirecting. It's night, everybody is sleeping, everybody is okay. Uh, let's go back to sleep. It really helps just redirecting them. So just some dementias have more hallucinations accompanying them than others, like the Lewy body dementia. The Lewy body dementia tends to have a lot more hallucinations with it. So depending on what dementia, there's a lot of types of dementia. Lewy body is one, and dementia is the high. Alzheimer's is the highest. Around 60% of dementia is caused by Alzheimer's, but there's over 100 types of dementias. So again, sometimes you hear people anytime there's a dementia, they use the term Alzheimer's. Dementia does not necessarily constitute to Alzheimer's, although Alzheimer's is the highest cause of dementia, rating at 60%. There's other conditions, like my dad has constricted vessel disease due to brain trauma, and that is the cause of the dementia that he has. Other people have different types of dementias. So basically, hallucinations is part of that. Some people have, if the hallucinations are too much to where they are keeping your loved one awake night after night after night after night, and there's you try everything and nothing helps, you also have to think about how it's affecting you as a caregiver or the rest of the family. So that's where the medications come in. Is there's medications that can help your loved ones sleep better, that can also be helpful for you as a caregiver and the rest of the family. But if the hallucinations are not too much, my dad, he's had hallucinations on rare occasions. He can go for a couple 3 months really without any hallucinations. So there is really no need of medications if they are happening on those rare occasions. Again, hallucinations can be a very normal thing with dementia. Also, the other thing to pay attention is urinary tract infection. UTI can cause hallucination. So if you see increased confusion, maybe even aggression, a lot of hallucinations that are especially sudden, like all of a sudden you see this change in moods, changing in behaviors that is sudden, that has not been there. Have your loved one checked for UTI, because UTI can cause a lot of problems. So don't, if it's not something that you've seen and it seems settled and baseline for your loved one, I don't use the word normal, because normal is so different for different people, but there is what is baseline for your loved one. As you get to know them and understand them, if you see extremely sudden changes, sudden hallucinations that don't make sense, redirection is not working, staying calm is not working, have your loved one checked for urinary tract infection, because that can cause a lot of problems. Otherwise, hallucinations can be a normal part of the journey with dementia. Caregivers, take care of yourselves and just ask for help as much as is possible. God bless.